Dr. Keller, what makes you think that people with life-threatening health issues are avoiding getting the help they need? What are you seeing?
Well, thanks. Yeah, it's what we're not seeing that's concerning us. Our volumes are down 40 to 50% at 40% at St. Paul's, 50% at Mount St. Joe's, all across Vancouver Coastal, and we can tell by the data what patients are not showing up, and it's not just infection related or flu-like symptoms. It's chest pain, stroke symptoms, injuries, all of the usual suspects that make up the case mix that comes to the emergency department.
Are you worried that we are going to see people die or get even more sick because they're too afraid to go to the hospital?
Yeah, I mean, that's what our concern is, because we know these conditions haven't gone away, especially people with chronic illness, people who are frail and most vulnerable. And, there are certain conditions like strokes and heart attacks, which our interventions are very time dependent. We only have a few hours to open up arteries and get circulation to the brain or the heart going. And if you miss that window, people can have permanent disability or they can die. So there's this concern that, people are so fearful of what might be at the hospital that they're staying home with something much worse.
And what's the reality? What are you seeing? You're in the hospital all the time. Is it a scary place?
No, it's a kind of a quiet place right now, but it's a very safe place. When the first concerns about COVID were raised in early March, we responded very quickly, and all the emergencies across Vancouver divided their emergencies into sort of COVID high-risk zones and low-risk zones, and we're very good about segregating the patients. We have meticulous infection control. I really think patients are at no more risk in the emergency department than they are at a supermarket or a drugstore, which is to say really no risk at all. People aren't going to get the infection by coming to the hospital, but they might have unintended and poor consequences by staying home with something more serious.
Dr. Dan Keller, thank you so much for being on the program today.
Great. Thanks for having me.